We are going to do asthma reviews. We're going to see some patients who have not had an asthma review for a while and just see if we can improve their control, see how they're getting on with their inhalers, see if there's anything we can do to improve, check how they're doing basically. We've been talking to patients about how to use their inhalers and the impact some of the inhalers have on the environment.
For people that are open to it, I think changing to dry powder inhalers can be really helpful.
Yes, especially patients who haven't been using their spacers, I would say.
That's very true.
It's quite a lot of patients.
Yeah. Today we're going to talk about how you've been getting on with your inhalers and what effect that might have had on your symptoms. Is that right? Yeah. This is, for many patients, a good, if not better, type of inhaler to use. And it also benefits the environment. So it's kind of win-win.
I can walk further without using my blue inhaler.
Yeah, good. That's brilliant.
But yeah, I'm getting better.
Well, I have a review every 12 months, so hopefully that anything new that's happening we get to know about.
You are on the Foster inhaler, aren't you?
Yep.
At the moment. It's the this one, isn't it? This device. Yeah, the dry powder one.
Yeah.
We've got this device which kind of looks at how strong your inhalation is, I suppose, and then we can make sure that it's still the right inhaler for you. Are you happy with that? So we're just going to pretend this is an inhaler. Really good. It looks good. Yeah. So what we're looking for is that the red dial is within the green, which obviously it is. So you're definitely breathing in perfectly for this type of inhaler. You don't need to breathe in any faster or slower. If you wanted to, we could try to go a step down, and then you just take it normally one puff in the morning, one puff in the evening, and that's the same device as obviously your blue inhaler. So how do you feel about that?
We can try it.
Yeah? I mean, obviously, and then we'll do a review again in 6 weeks. If it doesn't work, we can
go back to the Foster.
Okay, nice to see you again.
Yeah, you too.
Bye.
Take care.
Bye. So she came for an asthma review. She used to get a lot of chest infections and exacerbations of her asthma. So I saw her back in May where she was changed over to a different inhaler. We've talked to her about inhaler technique and also at the time about the environmental impact of aerosol inhaler. So she was swapped over to a dry powder inhaler. And actually since May, she's not been in for any problems with her asthma. So it was just a follow-up review just to see how she's getting on still. But yeah, no chest infections, no exacerbations of asthma, no asthma attacks. So overall, pretty good, really. We tried a few different inhalers, and I think one of them was making you feel a bit sick. I remember at the time. I think was it like you had like an aerosol, and it was you didn't like that particular one. No, and then we swapped you over to some dry powder inhalers. And how are you getting on with them?
Smashing now.
Yeah. Okay, good.
Yeah.
And how are your symptoms? Have you noticed a difference, or how are you?
I'm breathing a lot better.
Over the last 4 weeks, do you feel your chest has stopped you from doing things when you've been out and about or at home? So not at all, a little of the time, some of the time, most of the time, or all of the time?
It's only at night time.
Often, nighttime symptoms are an indication of asthma that's not so well controlled. Are you quite good at remembering to take them? Are you generally...
Well, I only take them if I need them.
Try to remember to take it mornings and evenings, just because we don't want you having an asthma attack or anything like that.
Well, it seems to help you breathe better, like your airways are more open. And I can walk better. I walk about now, I couldn't before. I were out of breath the whole time. I don't want to give up this one. Just after I've used it, I feel like there's nothing wrong with me.
Just bring your used inhaler in here and we'll dispose them all.
Okay.
All right?
Yeah, thanks very much.
Any asthma review we've done, either myself or one of the GPs, we discuss, swapping over to dry powder inhalers. If it suits the patient, obviously it doesn't work for everybody.